Start.
Good evening everyone. First of all, thanking patient and patient attenders for giving permission to do this medical review. And today we'll discuss about something called cholelithiasis with cholecystitis features. So a case of acute cholelithiasis. So she is a 60-year female patient. She presented to hospital with complaining of abdominal pain that is in the right upper quadrant, that is right hepatic region, with that is radiating to little backwards, and mild epigastric pain and mild radiating to the right shoulder, and multiple episode of vomiting. So we generally will think about what are the causes of this condition. So she is a 60 years female patient. She presented to hospital with all these cardinal symptoms. So you can directly think about something called as cholelithiasis, because she is having right hepatic tenderness, right hypochondric pain, mild radiating to the back, and mild epigastric pain, and that is right hepatic pain that is radiating towards the right shoulder. So this shoulder, why she is getting shoulder pain? Because there is something called referred pain. In cholelithiasis, the patient will get referred pain in the right shoulder point, shoulder joint pain, and she is having pain in the right shoulder with mild right hypochondric pain. So with this history, she came to hospital, and his past history goes that she is having all these symptoms since 4 days. Since 3 to 4 days she was having, and day by day that pain was worsening. And 2 days back she got fever, and with high all these presentations she came. So what you have to do is, we discuss what are the causes and what are the other differential diagnoses presented in the same complaints. So you just think that in a patient of any patient, they come to hospital with complaining of right hypochondric pain with epigastric pain. What you have to suggest, what you have to think is, if the patient is an alcoholic patient, and that too patient is having daily, he is an alcoholic patient, male patient, that too history of any pancreatitis patient, the directly diagnosis goes towards the pancreatitis, because in patient of pancreatitis there will be epigastric pain and epigastric tenderness with mild vomiting they will be having. So in this patient, she is not, first of all, there is no any relation with alcohol in this patient, and first of all she is not diagnosed to this. And one more thing is, if the patient is any patient of if the child, if you someone child who is came with all this complaint like mild liver tenderness, that is right hepatic tenderness with fever and nausea vomiting, you have to diagnose goes towards the what is the hepatic jaundice. With all this jaundice, hepatitis you have to diagnose. Any patient of baby, that is a child present with mild hepatic tenderness and vomiting, nausea vomiting with fever, we have to diagnose like a hepatitis. Maybe he got a hepatitis. In this patient, for cholelithiasis we'll discuss now. So how they will be, there is something called what is the formation, or what are the pathology behind the cholecystitis. You can see that in the patient of, what are the, first of all, who is a responsible person, like who was the main predisposing. There is something called 4F, that is fat, fertile, 40, female. So she is around more than 40 years, doesn't matter, and fertile age they are more prone to get, and fatty female they will more prone to get cholelithiasis. In this patient you can see her weight is too low, she is too obese, and you can say central obesity is more, she is having central obesity, and this all these things, she is overweight and obese. She may be having that she directly fit into criteria that cholecystitis. So what you have to do is that in patient of this condition, we have to suggest what are the, first we will think about what are the pathology behind this. So the pathology directly goes towards the, there is something called a bile flow is bile flow is going, and there is in the in the gallbladder there is the storage of the more stasis, or the more storage of the salt, that is called as bile salt will be storage. Because of this obstruction, there is occlusion in the cystic duct. Because of the cystic duct occlusion, there will be gallbladder will be get the bile will get stays in the gallbladder. Because of chronic stasis in the gallbladder, that bile will cause more inflammation. So because of this inflammation, gallbladder will get mild pain, tenderness, everything. This is called as cholecystitis secondary to cholelithiasis. So this is the condition. And one more thing is, because of this condition she will be having vomiting. So what are the clinical triad, or what are the clinical cardinal symptom is multiple episode of vomiting with right hepatic pain, with what you call a history of anything like fat, fertile, 40 female. In this condition we have to diagnose this. So today we got this patient and we examined, I will examine now, and she is having one more condition. She is having mild breathlessness. By seeing her, she is having mild pedal edema, JVP, everything. We suspect maybe a cardiac failure. Because of the cardiac failure condition, mild hepatic failure may be there. But after 2 days, she got fever. In conjunctive cardiac failure, there will be no fever. And what we have to do is we have to examine the abdomen now. थोड़ा ऊपर ले लो पैर, दोनों पैर ऊपर ले लो, छोड़ो उस तरफ ले लो। हाँ इतना है, हाँ इधर नहीं दुखता ना। लोअर एब्डोमेन इज नॉट हैविंग, इन द राइट हेपेटिक रीजन यूजुअली दुखता है। शी इज हैविंग टेंडरनेस हियर। इन एपिगैस्ट्रिक आल्सो शी इज नॉट हैविंग दैट मच टेंडरनेस। Here also she is not having that much tenderness. Only her tenderness is in right hepatic region. इधर भी दुखता है ना आपको। Mild she is having shoulder radiating pain with back pain. छोड़ पीछे, हाँ see this is the radiating pain here with radiating backward with shoulder. So this is clinical directly diagnosis goes towards the cholelithiasis. छोड़ो आप। So we'll discuss now in gross in nutshell. What we have to discuss is any of the age of there is a risk of there is patient of 4F, there is a fat, fertile, 40 female. If this patient presented to complaining with hospital with what you call as right hepatic pain with multiple episode of vomiting and mild fever or radiating to backward, if it is the same thing, if it is a non-alcoholic thing, directly we will suspect the cholelithiasis. So what are the investigations to be advised? So in this cholelithiasis, what you have to do, you have to go for the USG. USG is a golden standard and it will directly give the clues towards the cholelithiasis or any cholecystitis features. So next one more thing is what you have to do is what are the complications of the cholelithiasis. I will tell you one condition. There is something called Kaur-Weiser's law. This is very important because this Kaur-Weiser's law says that in the patient of jaundice, if she is having jaundice, in the patient of jaundice, if the gallbladder is palpable, that palpable gallbladder is not because of any other gallstones or anything. It is because of the cancerous condition, that is CA condition related to head of the pancreas or the pancreas neck. So this is one important Kaur-Weiser's law because gallbladder will never palpable. How much maybe that is cholelithiasis or how much it is obstruction, gallbladder will never palpable because it is a fibrous structure, like it is like a fibrous, it will never palpable. If the gallbladder is palpable in the patient, if she is having high jaundice, in the patient of high jaundice with the palpable gallbladder, that palpable gallbladder is not because of the any stone or anything, it is just because of the some CA condition. This is a Kaur-Weiser's law. We have to rule out first this. She is not having anything, or she is not, first of all, she is not having jaundice. And what we have to suspect if the patient of cholelithiasis or cholelithiasis, if they presented with high color jaundice, what are that we have to suspect, like if the cystic, that what are the stones that are obstructed in the cystic duct, that the stone may be dislodged, that may be obstructed in the common bile duct CBD. So because of the obstruction in the common bile duct, bile will never flow next. So there will be a stasis of the bile and patient will develop high color jaundice with clay color stools, high color jaundice with LFT. You have to go for the LFT, and total bilirubin will be raised and the direct bilirubin will be raised with the raised alkaline phosphate. With all these features, we have to suspect the stone may be dislodged. C may get an obstructive jaundice secondary to cholelithiasis. If it is obstructive in the common bile duct, it is called as cholelithiasis. Now she got only a cholelithiasis features, and what you have to do, what are the treatment? If she having any fever, anything, immediately how to give antibiotic. What are the selection of antibiotic? That quinolones are the best selection of antibiotic. You can go for the gram positive and gram negative coverage also, because gram negative, because if actually one of the complications of cholelithiasis is it may be the stone maybe goes towards the duct and they form cholelithiasis and obstructive jaundice. This is one complication. One more complication is directly goes towards the emphysematous gallbladder stones, that is cholecystitis. If it is the same feature, we have to immediately give the antibiotics and we have to go for the operation. Lab cholecystectomy to be done for this patient. And one more thing is, what are the antibiotics? You can add ceftazidime with sulbactam also. And for the sulbactam, it will almost act as a gram negative also. And one more thing is metronidazole to be given because of the gram negative coverage. And this is a acute cholelithiasis.